Hi everyone, I'm Dr. Roman Hunter, and today we're going to be talking about manual muscle testing, otherwise known as MMT. Now, MMT has 6 grades, from grades 5 to 0. Grade 5, otherwise known as normal, is when the person is able to complete full range, or in other words, throughout the available range of motion, and is able to hold against maximal resistance. The muscle is able to hold against maximal resistance. For grade 4, otherwise known as good, is when the person is able to complete the full range or the available range of motion and is able to hold against moderate resistance. So if you were to apply maximal resistance and the person breaks, that would be a grade 4, right? So it's just moderate resistance. For grade 3, otherwise known as poor, or fear rather, my apologies, is when the person is able to complete full range without manual resistance. So they're able to complete full range or go through the available range or go to any range just against gravity, in a gravity maximized position, all right? For grade 2, otherwise known as poor, is when the person is able to complete partial range. They're unable to complete the full range, just partial range, or you put them in a gravity minimized position and they're able to perform the full range in a gravity minimized position. All right? For grade 1, otherwise known as trace, is when the person just has a palpable contraction or a visible contraction. And for grade 0 is when there's no visible nor palpable contraction occurring in the muscle. And 0 is otherwise known as, you guessed it, 0. Alright, so when performing MMT, you want to make sure that the body part is exposed. You don't want to have it fully clothed or you have bulky clothing over the area that will limit the range of motion and you won't be able to see any visible muscle contraction occurring. So you want to make sure that the area is exposed and you drape them accordingly. Alright, now in terms of, just before we go, I just want to also mention that for some joints there may be some arthritic changes that will affect the range. So the person may not be able to perform full normal range of motion just because of arthritic changes occurring within the joint itself. May also be due to capsular issues or some internal derangements occurring in the joint. So you allow the person to take the limb through the available range that they have within their capacity, through the available range, or you take them to the end of their range. They're able to take themselves to the end of their range. And you perform the test within their available range that they have. Alright, so this is MMT, manual muscle testing, that we'll be talking about. Thank you very much. Today I have here with me Colin Armsby. And we're going to be doing MMT for shoulder abduction. That's MMT for shoulder abduction. The primary movers for shoulder abduction are the deltoids and the supraspinatus. The deltoids and the supraspinatus. Now the starting position for the patient is in a short sitting position, and the starting position for the therapist is to the side and back of the patient, right? You don't want to stand directly to the side because when you're about to abduct, you don't want to get hit and you want to give them the space for them to be able to move, swing their hand out to the side, okay? Some persons will do it in front, but ideally you'd want to do it from behind right here. I like to look slightly to the front as well so I can get the facial expression of the patient as they perform shoulder abduction. Depending, sometimes if they have any pain in the shoulder, you can also get some feedback in that manner as well. So the instruction that you're going to be given is to lift the arm up to the side, right? About 90 degrees for shoulder abduction. Stabilizing hand will be on the shoulder. It will be just between the neck and the shoulder right here. Right on the, if you want to call it the trapezius muscle, the upper traps. And as it relates to the hand that will be applying the test, you can go ahead and keep the elbow straight and lift the hand to the side for me. Lift it to the side, stop right there. So it's like lift it to the side towards the ceiling, stop, 90 degrees, palm down, elbow extended. You don't want the elbow to be bent like this, you want the elbow to be fully extended like that. That's the proper procedure. And the testing hand will be distal arm, just above the elbow, distal arm. It can also be out here, depends, like for athletes or persons who are really strong, you test both parts, distal arm and also distal forearm. Okay, so I'm going to apply the pressure right here, and an instruction I'm going to give: don't let me push it down, keep it there, resist me, Don't let him push it down, don't let him push it down, good. And he's able to hold against maximal resistance. Again, that would be a grade 5. And a grade 4 is if he breaks form on the maximal resistance. So he'll be on the moderate resistance, okay? Now, you can put your hand down. Grade 3 would be, go ahead and lift that arm up again. All right, good, stop right there. That would be a grade 3. Able to lift the arm against gravity alone. No resistance applied from the examiner. All right, you can go ahead and put your hand down. I'm just going to go ahead and show you what grade 2 would be. Grade 2 can be done in a short sitting position just like this. And go ahead and try and lift the hand up. Now, grade 2 would be he attempts to lift the hand. So he's able to complete and cover a little bit of range. He's unable to complete the full range like what you'll get in a grade 3, just partial range. So this will be a grade 2, okay? However, if it is that he's unable to move the arm any at all in this position, then you'll put him, there's an alternate position, then you'll put him down on his back to perform the other movement. So that's the alternate position for grade 2, and from grades 2 to 0, which I'll be showing you next. Alright, so now we have the patient on his back. This is the alternate position for grade 2, 1, and 0. Okay, so the instruction that you're going to give is go ahead and try and slide the hand out to the side for me. So now the person is able to move the arm through the full range and bring it back in. You can offer a little bit of support in case the surface that they're lying on has a lot of resistance. So you want to kind of minimize the friction a little bit by adding that support. Move the hand out to the side, move the arm out to the side, there you go. So this will be a grade 2 for shoulder abduction. And for grade 1, you palpate that area, the deltoid, ask them to move. And what you're feeling for is just contraction in the muscle. If there is any contraction, of course, that will be a grade 0, all right? Now, I had forgotten to mention that grades 1 and 0 can also be performed in a short sitting position. So when the person is sitting up, all you do is just cradle the arm and palpate the muscle belly and give them that instruction. Try and lift the arm, try and hold it there. If it is that you feel a little bit of a contraction, but they're unable to move the arm any at all, that will be a grade 1. If it is that you don't feel anything at all in that muscle belly, then it will be a grade 2. So the same position that you would have tested the person for grades 5 to 3 in terms of short sitting, that can be done for grades 2, 1, and 0 as well. And similarly, in this alternative position, the person can be lying on their back, and this only counts for grades 2, 1, and 0 as well. The person lying on their back, and you go ahead and give them that instruction to move the arm. If it is that they can move it, then that will be a grade 2. If it is that they don't move, but you feel a contraction, that will be a grade 1. And if you don't feel a contraction in the muscle any at all, that will be a grade 0. This is MMT for shoulder abduction.